27 years old man presenting with the history of trauma at a roadside accident about 7 days back, and has a lump at the which in the midline. This is the umbilicus, this area. So it goes into the midline, expands both sides, and it's bulging. So we have to basically see now that whether it's extraperitoneal or intraperitoneal. Sorry. Now, by pressing the probe at the center, it's painless to the patient. He is not feeling any pain. Now this is the appearance, and if we concentrate, then you will see that this is an extraperitoneal collection in the subcutaneous region. This is the skin, this is the subcutaneous tissue, this is the collection, and this white line represents the peritoneal line. This is the peritoneal line, this white line. So this is extraperitoneal, and it's approximately 22 millimeters deep from the skin. Millimeters deep from the skin, measures approximately 10.1 centimeters by 3.7 centimeters, and now where I am going to place the arrows is the peritoneal line, and so this is a collection in 22 mm deep to the skin from the umbilical region in the midline, measuring 10 into 4 centimeters, only 21 millimeter deep from the skin. And if you concentrate below the peritoneal line here, this is the peritoneal line, concentrate below the peritoneal line, and you will see gas shadows of the bowels. You will see bowel gas shadows. This area, dirty bowel gas shadow. Here you see a bowel segment. This is the transverse section. You can see the peritoneal line, and now I am going to take the longitudinal section, the maximum I can. Well, this is the longitudinal section. Now, this is the longitudinal section of the collection. I wish to get the approximate volume of this collection. It's about 293 or say 300 cc, 300 ml is the amount of collection beneath the skin in the subcutaneous tissue. Again, where I am going to place the arrow is the peritoneal line. So it's extraperitoneal, just below the skin, 22 millimeter below the skin, measures 9 into 8 into 7 centimeters with an approximate volume of 300 ml plus minus. You see, this is the peritoneal line, this area, this line, white line that you are seeing is the peritoneal line, this white line, and these are the shadows intraperitoneal. See this. Now its internal configuration is that of debris along with multiple thick and thin septa. This is all debris, sand-like areas are debris. This is debris, and these are the septa. The thread-like structures are septa, complete septa. This is the septa. This is thick septa, thin septa. So all type of septation is seen along with debris within this collection. So this is a hematoma in the anti-abdominal wall, extending from the umbilical region in the midline upwards. Its internal configuration, again echogenic areas. These echogenic islands, these are not septas, rather this is an echogenic area with no posterior shadowing, and this is consistent with the necrotic material or a clot formation. This is a clot formation rather, these are clot formations. No calcification is seen. This is not a calcification, rather this is a minor clot formation. So this is a study of subcutaneous collection with no intraperitoneal involvement, only 22 millimeter deep from the skin with an approximate volume of 300 ml plus minus. And this is the patient where I was scanning once again to show you that this is the bulge after the trauma, and this is the umbilicus. It's in the midline, expands on the both sides, and what you have seen in the picture is consistent with hematoma formation, that is extraperitoneal. Thank you.